So good morning. It is such a pleasure to be here. I want to welcome all of you to Stanford, including many of you who have traveled very far to get here. And I want to thank Michelle for inviting me to be here today and taking the lead in putting this wonderful conference together. I think the subject of this gathering is very, very timely. I'm honored. Just honored to be here in your presence, the presence of so many who are contributing in really deeply meaningful ways to the cause of global health. I know each one of you brings an incredible story, and many of those stories will be told over the course of this conference. Your work is so important to improving human health and to reducing health disparities around the world. So I just want to start by saying thank you for all that you are doing. Now, here at Stanford, our new president is fond of saying, we don't pursue excellence for the sake of excellence alone. Our mission is to use our gifts to benefit all of humanity. Our teaching, research, and clinical care at Stanford have the ultimate goal of benefiting people, both down the street and on the other side of the earth. The Global Health Program here is a great example of that vision. It's a vision that is replicated throughout the university. And it's a vision that's consistent with that of many of you in this room who are showing global leadership for the benefit of humanity in so many ways. Now, the specific issue you're addressing here today, advancing more women to leadership roles in global health, is incredibly important. And frankly, not only in the field of global health. I feel very strongly about this issue. It really goes to the diversity of thought and approach that is needed to solve the difficult problems in our world today. I've seen in many different sectors how challenging problems are tackled most effectively when we bring multiple perspectives to them. Diversity in race, nationality, income, ideology, and every other characteristic makes for better problem solving, and it makes for better decisions. As Michelle said, there is ample research to show this. It's certainly true for gender. Women have to be in a leadership role if our institutions are to effectively serve the broad populations they are obligated to serve. This is absolutely the case in global health, where women are 50% of the population and bear the primary responsibility in societies around the world for the health of children, the children that are our future. Put simply, we won't get the right answer without women in leadership roles. Now, that's really maybe easy to say, and maybe it's a little more difficult to achieve in practice. And one part of the challenge that I want to speak to for a few minutes, I believe, has to do with overcoming our intrinsic biases in society about what leadership looks like. It also has to do with the fact that we each need to develop our own authentic leadership that fulfills not someone else's vision of what leadership looks like, but our own vision for what is needed to bring communities together to solve really, really hard problems. Now, like all of you, I've learned a few lessons relevant to this discussion over the course of my career as I gradually took on some leadership roles. And I thought I'd just share a few of them. So in my case, one lesson I had to learn was actually about the value of leadership itself. We can make great contributions as individuals, but it is so important as a leader to be able to empower others to have an even greater impact. And in my personal opinion, that's the most important motivation for taking on a leadership role. And I think that's probably a motivation that unites many of the people in this room. Another lesson for me was about unique contributions I could make to the organizations I worked in. And here I just have to pause and acknowledge that it's even hard for me to say that I made unique contributions, because that's not what we say, right? But I found myself at one point in my career leading SLAC, the Linear Accelerator Laboratory. It's a $350 million, 1,600-person scientific laboratory. It was failing. It desperately needed to change its mission and its direction. And I was kind of a classic case of I was the director because nobody else would take the job. That's quite true. And being an unconventional leader was actually a strength at that moment. And it helped me do what needed to be done. But that leads me to the third lesson that I want to share, and maybe it's the biggest of all and sometimes the hardest, which is you never get everybody to come along with where you want to go. Not everyone is going to be in your fan club. That's a tough lesson. It's a very personally painful and difficult one. When I was working up at SLAC to shape a future for the laboratory, I was called Rumsfeld in Iraq to my face. I was referred to as the Manchurian candidate. Okay, I had to go watch the movie to see what an insult that was. You never, ever get comfortable with that kind of ad hominem attack, especially when it calls your integrity into question. But we each need to have the courage to follow our own inner compass that will show us the way forward. The trick to survival and ultimately success is to identify those people who will come with you on the journey and engage them in rewarding ways. I know each one of you in this room has your own leadership story, your own leadership lessons, and one of the benefits of this conference today is the opportunity to share these stories and share these lessons, and even more importantly, to discuss how to tackle these challenges on a systemic level. So thank you again for being here. Again, I'm honored to be in your presence. You have my great admiration for coming here and spending time to advance this cause. We are at Stanford delighted to host you. I wish you a rich day of conversations that will impact the lives of people all around the world. Thank you.